Okay, so on inspection, his skin looks not dry or flaky. To touch, it feels warm. Oh, look at your hair. He doesn't have any dryness in his hair. Inspecting his scalp. Can you smile for me? Good. And raise your eyebrows. Good. And then you're gonna close your eyes. I'm gonna hold your eyelids down and you're gonna push them up. Good. So this is checking for cranial nerves. His face is symmetrical. His smile is symmetrical. And then you can feel both equally on each side of the face. This feels equal.
Mm-hmm.
You can feel both sides like equally. And yeah. So I'm checking for his other cranial nerves for sensation. And then can you clench your jaw? I'm just feeling for his jaw muscles. Okay, good. Okay, so we're gonna move to eyes now, and I'm gonna do the Hirschberg test. So this, I'm just gonna shine a bright light on the bridge of his nose, and he's gonna look straight ahead. I'm just looking to see light reflection in his cornea, which I don't see any. So this is not present. And then I'm gonna do the cover-uncover test. So I'm gonna cover one eye, and you're just gonna look straight ahead. And this is looking to see if his eyes move when one is covered, and that signifies lazy eye. Okay, so both eyes don't adjust when I cover one. And then you're gonna just follow my finger. I'm gonna do the 6 fields of cardinal eye movement. So you're just gonna follow my finger without moving your head. So both eyes move at the same time, and neither eye strays away. His eyes, they're both symmetrical in his head, and they look like they both looking straight ahead at me. His eyelids and eyelashes are dry. I don't see any like red inflammation or like discharge around his eyes. And his so his lacrimal apparatus and conjunctiva are clear and no discharge, and they're not red. His sclera is white, and his pupils are equal in size and color. And I'm gonna look at his pupils, how they react to light. So you can just look straight at me. Okay. They both react fluently to light. And then I'm not able to do the red reflex, but that would just be looking into his pupils to see if they have a so I'm not able to look at the red reflex, but it is used to look to see if he has a red circle in his eye, and that's good. And if it's not there, then that could signify a retinal detachment. So I'm not able to do that, but I don't see any hemorrhages or lesions in his eyes, and he doesn't have any red pooling in his pupils. And his ears, they're symmetrical on both sides. I don't have a device to look into his ears, but I can use my light to inspect the inside. So there's no redness or bumps. The skin looks good. You got a little dry spot there. Might be some
eczema.
So I can't do the Weber-Ryan test, but that would be used to look at the air conduction to the bone in his ear, and you just put the device back here and you tap it, and he would tell me if he can hear it. But I'm gonna do the whisper test. So can you just close your other ear? I'm gonna whisper some words to you, and you're gonna repeat them back to me.
Dog, cat, what? 1, 2.
Okay. And then I'm gonna do on the other side.
3, 1. Ten. Date. Dog. cat.
Okay. So he passed the whisper test. He got more than 50%. So his nose, his external skin looks good. I don't see any red nodules or bumps on his nose. The bridge, I'm gonna just touch your bridge. Symmetrical on both sides. So I'm gonna cover this hole and you're gonna breathe out one nostril. Good. So I'm just inspecting his airway passage to see if they're both looking for continuity in his nasal septum. His mucous membranes, they look good. His hair is evenly distributed in both nostrils. So I'm gonna have you smell this. I'm gonna test one of your cranial nerves. I'm gonna have you smell this and tell me what it smells like to make sure that.
Smells like fruit gummies.
Okay, good. So I'm gonna take a look at your mouth and your lips. See if they're dry, cracked, or anything on them. No, they look red. Can you stick out your tongue for me? Good. I don't see any bumps or redness on that. Can you lift it up for me? Good. And then, can you say ah? Good. His tonsils are even on both sides. I'm not going to stick anything in your mouth, but that would be testing for gag reflex. So I would stick something in the back of his throat to see if he does have a gag reflex. I'm going to assess your taste. Okay, I'm going to do testing his taste, so let me know what you taste.
I'll taste like a candy orange.
Okay. I'm going to look and tickle your top of your mouth for your soft and hard palate. You can open up. Thanks. Good. They're symmetrical and no noticeable bumps. His teeth they're all there. His teeth are all there. So I'm gonna go to his neck now. I'm gonna take a look at his thyroid, lymph nodes, and look at where his trachea is. So can you just take a look up for me? Thank you. His trachea is symmetrical. I'm just gonna palpate your thyroid glands. I don't feel any bumps. They're both even on both sides. And I'm just gonna, you can go ahead and rest your head. I'm just feeling for his carotid pulses on both sides. And then I'm gonna listen for brutes. Good. I don't hear any brutes, which would signify possibly a clogged carotid artery. And then I'm going to take a look at his clavicle, scapula, and shoulders. So I'm just feeling for evenness. Take a look at your back. And your shoulders. You have any pain when I push in? No? Okay. So can you go ahead and lift your arm up? That one first, yeah. And then rotate it forward. I'm just looking for movement of his joints, and then do the other one. And then lift it up and down. Okay. He has full range of motion in both of his shoulders. And then can you twist your elbows and bend your elbows for me? Good. Full range of motion in both of those. And I'm going to do his bicep and tricep reflexes. And then I'm going to take a look at his pulses and look at his hands too. So his tricep reflex would be, this would be like a hammer hitting here. I would hit his arm. And they would do that. And then I would go here and I would hit my thumb. Go ahead and relax your arm. And I would feel for his bicep to contract. And then I would go down here. You relax your arm still.
So I was trying to keep it up.
I know, but his arm would be relaxed. And then I would hit my thumb here too. And I would feel for his arm contracting here. So I would do that on both sides. So I would do the tricep up here, and then his bicep right here, and then his brachioradialis right here down. And then can you rotate your wrist for me? Good, he has full range of motion. No tenderness when I push or touch your hands. Good.